All right, we are joined by Dr. Cynthia Snider. This is our last segment. She is the Infection Prevention Medical Director with Cone Health. This person is texting in, what are the main symptoms of COVID now?
So similar to the past, it's still, an upper respiratory infection where you can have nasal congestion, kind of runny nose, sore throat, and that leads to a cough with fever. We still see patients occasionally who complain of having like loss of smell and taste, but it's not as prominent this time around as it was in the past.
Yeah, because at the beginning it was kind of like if you knew you had that, that was it. You knew you had it. Okay. So now the follow-up question, this comes from another person. They said, I had COVID 2 years ago and I still haven't gotten my smell back. When will it return?
It's hard to tell. Some people do lose their sense of smell and taste, and it comes back roughly like 6 months later. And then there are those that take a longer period of time. So it is difficult to tell. There are some scent training exercises you can do that you can find online, but I'm not sure how successful they are the further out you get.
Of course, you're almost willing to try almost anything when you don't have those senses any longer.
Right.
This person says, I've had 3 boosters. Do I need to take any more?
So I believe they would be up to date. And right now, after receiving 1 dose of the bivalent, there isn't recommendations to get any more. And in fact, I believe the FDA and the vaccine committees are meeting later this week to discuss what the future of the booster looks like for COVID vaccines.
All right, because we've been kind of getting used to like every 3 or 6 months or something like that, getting another booster, and so maybe that will change. We'll just have to wait and see. Speaking of which, someone says, are the booster shots free if you don't have insurance?
I believe they are. There's still access to getting free vaccines. I believe you just have to go to the pharmacies that offer them.
Okay, and that might be just a quick online search to be able to do that. I have a question about getting your last booster. So if you're all up to date, like my mom, she got all of her vaccines and she got all of her boosters, but they ran out of space on the card. And so she's like, I don't know, my last booster is not on the card because they ran out of space. Should I go and get another card?
I think it's useful if at the next time you're at your doctor's visit, if that's where you received your doses, that they can write them down. Often enough, I like to just take a picture of my vaccine card, so it's kind of cataloged on my phone as well.
Okay. This person's asking, is it common for COVID to last more than 3 weeks? And I know there was a time where we said that you could test positive for COVID with the lab test for up to 3 weeks. So maybe that's what they're talking about?
So folks who are immunocompromised can have longer illness and then symptoms of illness, right? So it can be up to 3 weeks or more. And also your testing can stay positive for several weeks. And it depends on the sensitivity. The PCR test can be positive actually up to 3 months.
Okay, up to 3 months. Good to know. All right, we have a little less than a minute. This person's asking, should I isolate if I have COVID right now?
The answer is yes, resoundingly. Yeah, it is still very contagious to others. So even though you may have mild symptoms and are generally healthy, you don't know who you may expose it to if you're not isolating at home. And again, ideally it would be 10 days, but at minimum, you should be home for 5 days, and then those next, after day 6, wearing a well-fitting mask if you have to go back to work.
Okay, so home for 5 days, isolation for 5 days, then you can go back to work if your symptoms are gone, but mask up.
Yes, and not having any fever.
And no fever. Yep, that's key. Thank you so much for your time and your expertise. Hey, if you missed any of this, if you and your family have questions and you were wondering, hey, who really knows the answer to this? Well, we know the answer to this, and we're going to put it all online for you. It's going to be in the Who Wants to Know section.